Hi, hello there. My name is Lisa Smith, and I'm a children's continence nurse. I'm based in Hawke's Bay, and I have been a paediatric nurse for over 35 years, and for about the last 12 years, I have specialised in bowel and bladder problems in children. So today's talk is titled Going Potty over potty training, and I will just cover the essentials to get started. I'll put my PowerPoint share up, and yeah, going potty. And that's it. Great, wonderful. We're good to go. So yeah, toilet training. And yeah, if any of you have already, been through it, you'll know how difficult this whole process can be. And really, it is one of the biggest milestones that you will go through with your child. And it is a process that involves integrating lots of like the physiological, behavioural, and it can take many years for a child to be totally independent. And there are lots of models out there for toilet training, but every child is unique. And so as parents, you will know your child better than anyone else. So you will know what is going to work for your child. Sorry. Okay. So from the various journals and studies that are out there, the American Academy of Pediatrics and the Canadian Pediatrics, they say around about 18 to 24 months is round about the age to start. But again, this is just a general. In most cases, you've got to look at that window of opportunity where your child is eager to please and wants to do things to help you. So it's prior to the child becoming sort of really independent and me do it type stage. And I will say that, like I said, it is one of the most important skills that we need to teach our child, but it's also one that requires a tremendous amount of tolerance and patience. And yes, there will be accidents. You will be met with defiance. Hang in there. You will go potty, and all you'll think for weeks on end is potty on the brain, really. So, okay, and there's a lot of thoughts around whether we go and use the toilet or whether we use the potty, and everybody will have their opinions on this, and really there is no right or wrong. Many psychologists say is start as you mean to go on, and there's no confusion, so start with the toilet. However, it will vary depending on your situation and your child. I had a boy who did have developmental delay and brain damage due to fetal alcohol spectrum disorder. And he did take a long time to get the hang of potty training. And he was also very small, and it was difficult using other toilets. He didn't like change, and he was a bit wary of other toilets. So I erred on the side of have potty will travel. So we had a number of potties. We had, you know, a potty in the kitchen, a potty in the bathroom on the second floor. We were on 3 floors, and a potty upstairs in his bedroom. We also had the same potty in the car. So have potty will travel. And that, you know, that made it a lot easier because there was no stress. That if you could see he was needing to do a PP and he didn't have the language skills, he was delayed with his speech and language, but you could see that he was starting to do the PP dance or the poo-poo dance, and you don't get much time. So I just felt that anywhere, anytime, your potty's here, and he would relax and be able to be comfortable and happy doing his pee or a potty. And over time, as he got a bit bigger, we did transition to the toilet. So again, entirely up to the individual. But one of the important things that I must get across to prevent problems further down the line with constipation and partial emptying of the bladder, where they're not in the right position. And this is if they're in a squatting position, then the angle of the rectum is straight. So therefore, they are more likely to do an effective, completely empty their bowels. Sometimes on a toilet for a small child, it is difficult to get them in that proper squatty potty position. And basically their knees have to be above their hips and their feet has to be flat on a firm surface. So that is another reason why I erred on the side of using the potty for starting potty training in a young child who is small, and to them the toilet is just, wow, this is huge, and they often even though you do have all the equipment and things, for some children they're not relaxed, and that is the important thing. They do have to be relaxed to ensure that they have complete emptying of their bladder and their bowel. And a good, as I say, this is one thing that I use a lot of the time when I'm talking to clients in my clinic. And definitely go and look at this YouTube video on the unicorn, and it's all about the Squatty Potty. And it is hilarious, but it really does get the point across of ensuring that there's effective elimination, and really that constipation in children is extremely common, and it can often start around the potty training period. So we need to minimize that as much as possible. And we have to always focus on the 4 B's approach to potty training. The brain, bowels, bladder, and behaviour are all closely connected. And certainly if your child does have some form of developmental or behavioural issue, then this complex skill may need to be delayed, and it may take longer. And certainly if they are not ready, then it can result in problems further down the line. And certainly over the years of doing my bowel clinic, well over 25% of children did have toileting issues, and often the trigger was that the toilet training got started too early and just put a lot of pressure on the child. So when should we start toilet training? And I think the first thing is, are they showing interest? Are they a bit uncomfortable? Are they acknowledging that they're wet or they're dirty? Are they able to stay dry for 2 hours? And I think, are they capable of learning the skill right now? Have they got good communication skills? Are they able to make their needs known? And one person kind of said if they can recite A, B, C, D, or they have 5 instructions that they can understand or inform others, then they are ready. Have they got the physical maturity to be able to complete all the tasks involved? And I think what I said earlier on is there is that wonderful time where you have a very happy, eager to please toddler. And, that is often around about the 2-year age. And certainly that is a really good time to crack it, to really get on top of it. Like I mentioned earlier on, no one successful theory. There's lots of things on Mr. Google. You've got to work with the child that you have. So if some toddlers are terrific, some are tough, and some are torturous to train. So the individual personality of the child will have a huge impact. And yeah, if they are a defiant, willful kid, prone to tantrums, then it is possible that it could be magnified during the process of potty training, because these kids, their personality, they like control and they like it their way. And that's where parents really do have to stand strong and stick to the rules. And it's tough. It is hard going, but you will get there in the end. Okay, so some of the precursors to starting toilet training. And when I did it with my boy, I decided to take 2 weeks completely off work. I completely cleared my calendar. I had nothing organised. It was basically, this is what we are going to do. And as I say, he was delayed. It was probably around about 3.5 years of age. I did get a lot of pressure from grandparents, all well-meaning, saying that, oh, he's awfully late. You should have started early. They should have been out and nappy. You will get that pressure. You start when it's right for your child and when it's right for you. Okay, so the best time is when you are going to be completely focused on the toilet training. Clear your calendar, and the other thing is avoid telling people that this is what you're going to be doing. keep it on a need-to-know basis, you know, a low-key approach, because you're going to get people giving their opinions and questioning things, and don't doubt yourself. Other people will try and put these doubts in. You know your child best. You know what's going to work. You just need some a few basic rules to help you on this poo journey, or you know, this toileting journey with your child. But what I will say is, the more time you invest in this important life skills, the more likely it is going to stick long term. Okay, so there are heaps of books out there all about potty training, Princess and the Potty, pirates going on the potty. You know, I've got one called Everyone Poos, which is fantastic. Yeah, you probably get Everyone Poos is a really good one. There's other ones, and it's all just about potty training, and definitely lots of positive toilet talk. We often think of poo as being yucky and smelly. Try not to show that, you know. Try and say that, hey, when we have a happy poo, our bodies are happy, that poo is the rubbish from our body, and you know, we've got to get rid of it every day in order to be able to play, in order to be happy. Other things is teaching the concepts around the whole toileting process. What's it like to be wet and dry, dirty or clean, front to back? Making them a bit aware of their body, and also trying to get them to dress and undress themselves, so that again they're learning all the skills that are involved in becoming independent around their toileting. And yes, time of work. You know, that really it is one person in charge starting this process, so that there's no confusion around communication and supporting your child. The more people involved, the more likely the child will become anxious and stressed, and this is the last thing we want during the potty journey. So yes, when I did it with my boy all these years ago, I did feel I was going potty, but it was well worth it. And yeah, you probably do feel like what they call a mombi, an exhausted mother that feeds on coffee and survives on wine. Well, I think that was definitely me, because we did have a child who was very willful, had tantrums. Because of that, I didn't know he had brain damage at that point. It was only later on. But yeah, we had a very willful, defiant, difficult child, and there were certainly a lot of accidents. Okay, so keep calm and believe that you can do it. So the toilet training steps, it's really like a tower of blocks, sorry. And you've got to get that first row right. You've got to get it strong. You've got to get that foundation right. It's repetition, being consistent, okay? And if you don't get that first row right and make sure that that is truly cemented in, then it could all come tumbling down. And there is no time limit. Okay, some children will learn that the first block within a few days, For others, it can take a lot longer, as in with my boy, it did actually take quite a lot longer. And this is really, I use this in all my aspects of paediatric nursing. It's really my 7 Ps for a child learning something new. And you work, again, you go at the child's pace and you look at the child's behaviour. All behaviour is communication. And one of the first things that the 7 Ps is play, you plan, you practice, patience, perseverance, praise. Be positive. Okay. And so the first part of P is play. And you can use Teddy, or you can use one of their favourite toys, and you start telling a story about Winnie the Pooh needing to go to the toilet, you know, and you go through the process of, oh, Winnie the Pooh, oh, I can see you're needing a pee-pee, Winnie, let's go to the toilet, oh, good, you know, and talk it through that way. And it helps the child learn something new, you know, in a fun way. And if we make learning fun for a child, they will learn it better. It will yield results a lot quicker. Okay, so here is just some ideas. And I remember we used to have a doll that could eat, drink, pee and poop, would you believe, called Baby Alive. And it was really good to, you know, as a precursor for the connections between the brain and the bowel and the bladder, to thought, oh yeah, you know, that this is the doll doing that, and maybe this is what I should be doing too. And there's lots of fantastic YouTube things now all about poo-poo going to the toilet. The Wiggle toilet song is fantastic. If your child has got the trigger brain and doesn't like to sit for very long, is maybe something active while they're sitting on the potty, is maybe throwing softballs into a box if they like balls, if they like singing. So again, you've got to use your imagination, and you've got to know what will be a buy-in for that child. What are their interests? And use that in the toilet. Often the toilet environment can be quite cold and clinical. And certainly to start with, again, there's all different thoughts in that. As some people say, is start where, you know, pee and poo should go, in the bathroom. Okay. However, you know, it may be easier in the kitchen, you know, so you could still be doing lots of things, you know, getting dinner, you know, and you know, that you could be playing with the child in the kitchen, and if they do have an accident, it's easy to wipe up rather than anywhere else where they could, you know, like on a carpet. So yeah, work in an area that you know, because if you're going to be starting the toilet training, you're going to be in that place for a long, you know, that's going to take up a lot of your day. So certainly with my boy, we said, right, we start in the kitchen, and we did a lot of painting, we did a lot of stuff, and then whenever we saw the signs of pee-pee dance, then you know, I would prompt him to or take him to the potty to start with. Okay, and as I say, the you must have a look at the toilet song by the Wiggles. So yeah, the second P is of my P plan for potty training is get a rough baseline, you know, for the week. and just make you know, document it, elimination communication. When they do tend to wee, what times they tend to poo, what sort of behaviours do you notice prior to them going, you know, having a pee? You might not see anything because some kids are pretty sort of private about all that sort of thing. But try and get to know your child's routine so you can try and fit the toilet training around that. Get the equipment, okay? And, you know, again, you're aiming for the child to be able to do as much for themselves. You know, steps to the toilet and the sink, can they reach the toilet roll, the towel, the soap? Again, that might be too much for some children. It was too much for my boy. That basically it was a case of let's just go for to start with, getting him to know that oh yeah, I need to go for a pee, and they will go and do it in the potty. And that was really the main aim for me to start with, and then I gradually introduced the other steps as he got a bit older. Be consistent around what words you're going to use for pee-pee, wee-wee, poo-poo, poop, whatever, you know, so there's no confusion for the child. Okay, how are you going to start? Okay, what are you going to tell your child? And be quite clear, okay? Today, you're going to be a big boy, girl, and you're going to put your pee and poop in the potty or the toilet. And I'm going to teach you how to do this. And your nappy will only go on for nap times and when you go to bed to sleep at night. So it's very clear communication. Okay, so the third P is practice. As I say, it is a complex skill. There's 13 steps for a child to be totally independent with toileting. So you focus on the essential ones that you feel your child is capable of doing. And the steps generally I'm clueless, they just pee, to I've peed, they'll say, oh, I've peed, to I'm peeing and I have to go pee. And it is, like I say, it's unique to every child. But on average, if you've invested the time, you've been consistent, then hopefully they will have learned. That skill will be there after about 3 weeks. That they'll have gotten the foundation right. Okay, patience, and I call it the duck. I've had to be a duck for many things with my boy because he had very challenging behaviours. So keep chilled. Watch your body language, your facials, your tone of voice, because the least little thing, the real frown or you're frustrated and you've got just an impatient tone in your voice can set the child back. They're in tune with you and they will sense if you're getting frustrated or annoyed. You know, if you know this is happening, take 10. You know, none of us, you know, we know our limits. We have to know our limits, and you maybe have to take 10 and let somebody else step in to support, because this is hard work. Okay, so perseverance. I love this word. Okay, that there's no guarantee of success, but there can be no success without it. And these can be the hardest days of your parenting career. And there will be lots of accidents. You know, there may be difficult behaviour with your child. You've got to watch your child like a hawk, okay? Because you turn your back for a second and you know, it's on the floor. And you might feel at the end of the day, I've got nowhere today. You may feel you've failed. But always remember that fail is first attempt in learning. This is a complex process, okay? And for a child who's been used to having a nappy on their bum for 2 years, having it removed is tough. they don't like change. Change is tough. Okay? And, you know, and if after a week they're still clueless, then, you know, maybe just look at, you know, review your approach. What can be done differently? And often it's the parents that you may be quite intense and over prompting and over hovering and too anxious, and you know, and you want this to work, and you're putting that pressure on your child, and they sense that, and that may have a counterproductive, you know, maybe counterproductive. So the 6P is praise. Okay, so label the praise. Be specific. I'm very proud of you. Mummy's proud of you for doing your pee-pee in the potty. Huge hugs. Go in the world. Okay? Clear communication. If there is an accident, keep it fat. Keep the emotion out of it. Just say, hey, pee-pee goes in the potty, not on the floor. You know, and hey, if rewards, bribery works, and some kids it doesn't, but you know, bribery works, then use it. Okay, and the last P is remain positive. Okay, just think about how you're talking to your child. Okay, and that you are the best teacher for your child. Okay, and look forward to the process. A lot of parents, you hear them say, oh my God, we've got to start the toilet training at some point. I'm really dreading it. Get that, you know, you've got to get that these negative thoughts out of your head and think positive, and then you will act positive. Okay, and look on the toilet training when you're completely clear on your calendar and you're just focusing on your child. Look on it as a very special bonding time with your child, because you're going to be with them for the whole day, the whole week. Okay, and get lots of fun things for you to do with them. Okay, and that never doubt yourself. Okay, and don't let other people make you doubt yourself. Okay. Okay, positive. Strive for progress, not for perfection. Okay, you're never going to get complete continence in a child. Sometimes, like studies have shown that children may not become fully continent until they're about 6 or 7, but there may still be accidents up to that point. And nothing worth having comes easy. That you're going to teach them one of the most important skills that they will be using for the rest of their lives. Okay, now I'm just going through one method for toilet training, and this is by Jamie Glowacki, who is a potty training expert. She does have a book all about potty training as well. And the first step is get rid of the nappy. The child is naked, okay, and she always recommended just having it in the kitchen, clean the mess up, and that you're keeping an eye on them while you're maybe able to do other things, and you can be doing lots of fun play with them as well. Watch for the wiggle signs and prompt. Okay, don't ask, do you need to go to the toilet? It's like, come, pee-pee, potty time. Give them plenty of fluids, and you're focusing on this and nothing else. Okay, no distractions. And again, accidents will happen, but what you're looking for is that eventually they will, like, they'll get that bladder sensation and know that the pee-pee goes in the potty. Okay, if you don't get to them in time, give them a surprise. And I had to do this with my boy when he started to be, oh, I would go, oh, and immediately stop. It would give him a wee fright, and I'd pick them up and put them on the potty. Okay, and you still get a wee pee on the floor, but hey, you've managed to get most of it in the potty. So success, okay? And yeah, if these do happen, just clear communication, okay, in a casual manner. You pooped on the floor. Poop goes in the potty. You sit on the potty to poop. That's it. Try, and the other thing is try not to overprompt them. Okay, don't keep saying every 2 minutes you need to go to the potty. Don't ask. Okay, just look for the signs. Okay, that they're starting to feel a bit uncomfortable. They may wriggle. Okay, they may go on the tippy toes. They may go and hide. They may just go quiet. There may be a change in their facial expression. It's all different to each child. Okay, so the step one success is that they're starting to get it. Okay, and they are starting to, I need to pee, and they're holding on, and they will go in the potty. Or you see the signs of them holding on, and you will just prompt them, go potty. Okay, don't ask. And you can tell just by the way is that you keep the information short. Okay, very clear, short instruction. The step 2 is going commando. Okay, and you've still got to watch them like that. You've just about got like most of the pee and the poop going in the potty. You're still watching them like a hawk. Okay, you put loose pants, boxer shorts, and nothing snug around the bum. Okay, and the reason for that is muscle memory. Is that if you have tight underpants around the bum, the muscle memory saying that the child or the brain gets confused and thinks it's a nappy, and then they will then just fall back to doing pee and poos thinking they've got a nappy on. So whatever they're wearing in their bum area is make sure that they are nice and loose, and that their clothes are easy to get off. For a girl, I would be having them in a dress, and for a boy, hey, if you could keep them just in boxer shorts, elasticated pants that's loose, then they're able to get them down very quickly. And at that point, you can start to go on very short outings. And again, that's where I had, have potty will travel. But continues to say as before, keeping in nappies for nap time and for night time. And, you might waver between, we've got the stepping blocks, you might waver between step 1 and 2. And they may, at this point, start to self-initiate, but you still need to watch them like a hawk and prompt when you see. And consistent self-initiating can take many weeks, okay, for majority of children. And if there is sometimes you think, oh, things going really well, and then they start becoming a bit more resistant or they have a few more accidents, is that maybe we're just being too much of an ego, okay, that we've got to give them that benefit that they know what they need to be doing. So, sometimes you need to back off. And when they say, no, I don't need to go for a pee, believe them. Okay, but possibly say, yeah, okay then, I trust you. Come and tell me, okay, when you need to go, so I can help. Okay. Okay. And like I've said before, there's no definite timelines. Each child is unique. There will be resistance because they don't like change. And letting go of their nappy for some toddlers is extremely hard. But, be consistent. And I actually timed the nappies going round about Christmas time, so that my boy, you're a big boy now, and we gathered all his nappies up, and said, you're a big boy now, we don't need these nappies. Santa will take them to the babies that need the nappies. That seemed to work well for him. So step 3, peeing and pooping in different situations, okay? And that's where you start to get into a routine, elimination communication. And most kids, as I say, there's certain times that they will pee when they wake, before they go to sleep, before leaving home and when they get home, after prolonged sitting, after activity, so you'll get to know your elimination communication. And I know, it is establishing a routine, and you can reinforce that, like say, yeah, we can go to Granny's or we can go out and play but you've got to go for a pee-pee first, and Mummy's going to go for a pee-pee too. So it's not just they that we all have to go for pee-pee. So longer trips, you can, at step 3, longer trips. You still have to be that hawk. It could be weeks and weeks down the line, and be conscious that when they're likely to poo. Children, again, many of us are creatures of habit, and we just like to do it in one toilet or one place, and it tends to be at home. So, get to know their routine. And if they say they poop at 10 o'clock every morning, then wait until they've pooped before you then head out. Make sure that you're prepared when you go out, you've got all your equipment, and we could start to back off a bit from the prompt time, from being that hawk. Okay, so step 4 is that you can start to put undies on. Okay, and there's a few examples there. Is that some kids, if you get them Dora the Explorer or Paw Patrol or Spider-Man undies, there is no way they will do a pee or a poop in these wonderful undies. So that could be a really good incentive for some of them. A tip I would suggest, so that you don't go backwards, is maybe buy a size up, so that the undies are still quite loose fitting on the child, so that they don't have that muscle memory and safety. They're not thinking that, oh gosh, I've got my nappy back. It's a subconscious thing, and that they may, if they've got that busy brain and they're busy doing something, that they may just think that they can do a pee or a poo. Is keep the undies quite loose. So then we get to step 5, okay? And what I'm going to say here is that this could carry on for many years, up to about maybe 6, is that as long as they need you to support them with that, that's what that is just the way it is. And also, monitor. Don't just, we're successful and we're not having any accidents anymore. You still have to check in with them. You have to be their poo knee monitor, really, but definitely with the poos. Because we're all leading busy lives. The kids go to daycare or off to school, and parents are working. And I've had a number of parents that they don't know when their child poos or when they last did a poo. And then they suddenly wonder, oh my gosh, my child's soiling, and they've got severe constipation. And so we do have to remain vigilant. And for as long as that is your child needs you to be that for them. There may be, again, there are some situations, maybe there's change going on in the family or the child. Often a period of hospitalization, either with the mother or with the child, can actually cause regression, and sometimes you do have to reset, that you do have to take the stress out of the situation. And you know, often I say, if you've gone backwards, then cut to the chase, is avoid the stress and the frustration, because it's not going to help you or your child's relationship. Is put them back in nappies for a few weeks and then start back at step one, and you'll get through the steps pretty quickly. But there are times that, you know, and if you're at your end of your tether for whatever reason, then often that is the time for a reset. Okay, and the reset is that put them back in nappies, take away all the toileting equipment, just focus on your family harmony, and just no toilet talk at all. Just take the heat out of the situation. And often kids just feel a sense of relief that that it's, for whatever reason, they've become quite stressed by the whole thing. But certainly don't let the child control this side of things, that you make the decision, you take the stuff away. And if the child says, oh, but I want it, and then they don't follow through, then just say, that's it, we'll just leave it, it's okay, we'll wait for a couple of weeks and then we'll do it again. And finally, okay, as I say, be strong. Okay, is children feel a lot safer if they've got very clear limits and boundaries around their behaviour, and they've got good routine. Don't let the child be in the driving seat. You're in the driving seat. And give them the choices. Don't give them heaps of choices. I always keep the choices with my boy, even now, and he's 22, is I'll give them a couple of choices, but either of the choices would be the choice that I would want, you know. And a strong, well-determined child will challenge these boundaries more during toilet training. And yeah, again, try and not let that interfere with your relationship with them, as I call it, love big. But again, you have to stand your ground and not put up with unacceptable behaviour. So that is kind of a very a generalised overview of potty training and how to start, how to go on the journey with your toddler. This is the service that I offer, the Children's Continence service, and I have various programs where I do cover toilet tactics, which you know, give them assessment and a plan to help with a child's individual toilet training journey. I also support families with daytime waiting, bed waiting, constipation, and soiling, and regularly do workshops on childhood continence. So yeah, thank you for listening to me, and I hope that those of you who are looking at starting on this potty journey with your child will embrace it and look forward to that time invested with your child. Thank you very much for listening.